Hello Pharma friends, welcome to GDC English classes. So in this session, in this short session we will discuss about the alphabet pharmacology of levodopa. So this is the some new way, the new technique to understand the specific drug pharmacology, its adverse effect and its total information in its alphabets like levodopa, Levodopa. So like that alphabet pharmacology. So let's see, you can understand. So what is the insight of this alphabet pharmacology? And definitely this way of teaching you will I hope you will enjoy. Okay, so as you know already, the levodopa is a precursor of dopamine, especially for the treatment of parkinsonism. So parkinsonism is a neurodegenerative disease of the central nervous system, in which case there is a imbalance in dopamine and acetylcholine in the substantia nigra of the brain. Okay, especially decreasing dopamine, increasing acetylcholine is a characteristic feature of Parkinsonism. So let's see levodopa. So levodopa, the first letter is L. So that is L-dopa is first drug of choice for treatment of Parkinsonism. Yes, many number of drugs are there, but first we have to start with this L-dopa, and along with L-dopa there are number of drugs are there. So this is the first drug of choice for treatment of Parkinsonism. Next letter is E. So the levodopa having extremely short half-life, around 1.2 hours, because of first pass metabolism in the peripheral. That is, levodopa may convert into dopamine in the peripheral, and in presence of enzymes like dopa decarboxylase, dopamine. So dopamine as such unable to enter into blood-brain barrier. But the major drawback with levodopa is in the periphery, the levodopa converts to dopamine. Levodopa is like amino acid, and if this levodopa converts to dopamine in the periphery, dopamine is a neurotransmitter and dopamine is a catecholamine. So catecholamines are polar in nature, that polar compounds unable to reach the brain. That's why levodopa should be protected. Levodopa should be reached into the brain. In the brain it should convert it into dopamine, but in the periphery should not convert into dopamine. That's why along with levodopa, dopa decarboxylase inhibitors like benserazide like drugs are useful. So next letter V. Next letter is V. So V, visual as well as auditory hallucinations. So because of using of levodopa, this levodopa enter into the brain, releases dopamine. That dopamine binds to the receptor and helps in the treatment of Parkinsonism symptoms. But the side effect of this levodopa is like visual as well as auditory hallucinations, false perceptions. And next letter is O. Oral administration and taken during empty stomach, and generally levodopa preferable through the oral route. But the drawback, first pass metabolism due to degradation in the GIT with help of dopa decarboxylase. That's why levodopa should combine with the benserazide carbidopa to prevent a degradation from dopa decarboxylase and make entry of levodopa into brain. And next, letter D. Discoloration of urine, saliva into brown color due to melanin pigment from the catecholamine oxidation. So in the catecholamine nothing but dopamine here. So adrenaline, noradrenaline, all these are catecholamines, and here it is dopamine. During the dopamine metabolism or inactivation by the oxidation process, it may increase the melanin pigment. That melanin pigment changes the urine color, changes the saliva into brown color. Next letter is O. Only levodopa enters into brain, but not dopamine, because dopamine is a catecholamine. It is a polar molecule. Polar molecule not easily enter into the brain. But how dopamine present in the brain? Because dopamine sensitized in the brain. That is common. But why we are taking levodopa in Parkinsonism? In the Parkinsonism, dopamine levels are low. Dopamine levels are not sufficient. That's why we are taking. And after levodopa enter into brain, it converts to dopamine. dopamine binds to dopamine receptors, reduce the Parkinsonism symptoms. Next letter P. Next letter is P. So here P, pyridoxine. So pyridoxine decrease the action of levodopa by promoting its peripheral metabolism. So pyridoxine may decrease the action of levodopa by promoting its peripheral metabolism. That is, promotes conversion of levodopa to dopamine. If this happens, very less amount of dopamine reaches the brain, and that leads to poor pharmacotherapy, poor nothing but POR, poor treatment in Parkinsonism. And last letter is the A. So levodopa may cause anorexia, loss of appetite, and may causes vomiting. Generally, these are the drugs acting on the CNS. So that is the commonly they can produce the nausea as well as vomiting sensation. And side effects like you can see levodopa cardiac arrhythmias, nothing but increasing heart rate, because if levodopa converts to dopamine in periphery, the dopamine having stimulatory property in heart, so it may increase heart rate, palpitation, the beat sound increases, tachycardia, number of beats increases. And one of the common drawback, fluctuations in response, on or off effect. So on or off effect is one of the drawback of this levodopa. So means what is the meaning on or off? When treatment is going on, the symptoms are disappear. When treatment is stopped, if patient is not taking the drugs, again the symptoms will be appear. That is on off phenomenon, fluctuations. During the treatment, okay, the symptoms are decreasing. But once the patient feel yes everything is okay and stopping taking the drug, definitely the symptoms will appear again. That is on off phenomenon. So that's why, because of these fluctuations in response during treatment, sustained release formulation of levodopa and carbidopa produces more stable plasma concentration, helps to reduce fluctuations in response. So to regulate these fluctuations, these drugs are taken as a sustained release, slowly released formulation, depart formulations. So they maintain the plasma concentration constantly and control the fluctuations. And not only sustained release formulation of levodopa, and apomorphine also used in fluctuation response to regulate, to prevent on or effect of levodopa. So apomorphine is a derivative of morphine. If morphine undergoes reaction with help of HCl and heat, it gives apomorphine. Apomorphine is a emetic drug, and apomorphine is also helps in the regulation of or preventing on or off effect of levodopa. So this is simply the alphabet pharmacology of levodopa. I hope definitely based on this you can remember the whole information of levodopa in a single slide. So like this interesting videos, concept based videos, subscribe to GDC English Classes YouTube channel. Thank you.